submit their statement or question in writing to the village manager's office, and all properly submitted statements or questions will be submitted during the relevant portion of the village board meeting. Written comments may be submitted by email to citizencomments@skokie.org before or during the meetings, by mail to Village of Skokie Village Manager's Office, 5127 Oakton, Skokie, Illinois 60077, or via the village's drop box, which is located just outside the public entry to Village Hall. And now we will be led in the Pledge of Allegiance by Village Clerk Pramod Shaw.
I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all. The meeting will come to order, and the clerk will please call the roll.
Trustee Roberts,
Here.
Trustee Sutker,
Here.
Trustee Ulrich,
Here.
Trustee Bromberg,
Here.
Trustee Klein,
Here.
Trustee Gray Keeler,
Here.
Mayor Van Dusen.
Here we have a quorum. The next item on the agenda is approval of the consent agenda for this evening's meeting. A motion is in order. Trustee Klein, seconded by Trustee Ulrich. Is there anything on the consent agenda that anybody would like to have removed? If not, call the roll, please.
Trustee Roberts,
Aye.
Trustee Sutker,
Aye.
Trustee Ulrich,
Aye.
Trustee Bromberg,
Aye.
Trustee Klein,
Aye.
Trustee Gray Keeler,
Aye.
Mayor Van Dusen.
Aye, the motion passes. The next item is report of our village manager, John Lockerbie.
Thank you, Mayor Van Dusen and Village Board. Good evening, everyone. Item A is regarding the COVID-19 update. This evening, Mike Charlie, our Director of Health and Human Services, is with us and will be providing the most up-to-date information that we have.
Good evening, Mayor Van Dusen and the Village Board, and thanks for allowing me an opportunity to come again tonight and provide an update on COVID-19 here in Skokie. The two items on the agenda tonight that I'd like to discuss is I'm going to briefly go over some updates on COVID-19 data, and then I'm going to provide an update on our COVID-19 clinic and our progress towards vaccinating Skokie residents. Specific to data, the total cases in Skokie as of today is 5,145 total resident cases and 108 total deaths. The good news is, and the chart on the following page will show this, is that our 7-day moving average is down to 14.25 cases per day, which is far less than it was back in November and less than when I was here approximately 2 weeks ago. In addition, the Skokie positivity rate is also down to 4.2%, which is less than it was previously. As a reference of comparison, the Cook County positivity rate's right around 5.4%, so we are less than the Cook County rolling average. On the next slide here is a graph that shows the downward trend in regards to cases per day in Skokie, which is really great news. So I certainly want to give kudos to the Skokie residents and the Skokie business community for continuing to do the best they can in reducing COVID-19 cases in Skokie. I did want to provide a brief update on Restore, Illinois. The last time I was here, Skokie was within what's considered Tier 2 resurgence mitigations, and with 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 the data trending in the right direction, we're actually now in Tier 1 resurgence mitigations. I couldn't possibly list all the different business types and all the different updates to this, but I think that the general public seems to be interested in bars and restaurants. And now indoor dining is allowed in Skokie. And it's limited to 25 guests or 25% room capacity, whichever is less. And it includes things like patrons have to be seated at tables 6 feet apart and a maximum of 4 per table. So the state is still trying to limit how people dine in order to prevent COVID-19, but certainly as the numbers trend in the right direction, the state's going to continue to loosen up the restrictions, which I know for our businesses couldn't be soon enough. And I also threw in there something about weddings, about being limited to 25 guests or 25% of room capacity. There's also sports guidance and other guidance. It's all available on the state website for the public to review. This just is a slide just describing sort of where we're at. We are getting closer back to phase 4, which is revitalization. We're currently at that Tier 1, that black circle, moving towards phase 4. Next slide, please. So vaccine update. So let's talk vaccine. So to date, we've given 3,750 doses to the North Shore University Health System. These are part of the Skokie supply, and this is a coordinated effort through the state. This isn't something where they're begging us for doses. This is a very coordinated process where we give doses to the hospitals to make sure that that initial phase 1A group gets vaccinated. We here in Skokie have been receiving the Moderna vaccine. We have transferred 300 doses to our federally qualified health centers, and we'll continue to do that as vaccine supply is available. It's important that we're able to provide the vaccine to those clinics, outside clinics, so we can share the load to make sure that Skokie residents can be vaccinated, not only at our local Skokie clinic, but also at those clinics. 3,560 doses have been administered to date. We have 1,920 doses that are scheduled to be administered this week at our clinic. We are not stockpiling vaccine. As soon as we get the vaccine, we are pushing it out. By the end of this week, we'll hardly have any doses, and then we'll hopefully get a new shipment by the end of the week for next week, where we'll start planning additional vaccination clinics. I did want to mention that working through our communications department and Ann Tennis, the village started delivering late last week a postcard to every Skokie address. And this postcard provides information, including where residents can find additional information on COVID-19 specific to Skokie. It also encourages residents to pre-register with the village so that we can notify those residents when we do have vaccine available. It also encourages people to sign up for Skokie e-news so that they can be notified that way also. So we knew that not everybody has an email address, and we know that not everybody can be called, so this was something that we did in order to canvass the entire village of Skokie so that they're aware that we are providing free COVID-19 vaccine, and to provide them direction on how to register to be notified when they qualify and when they come up within the list of registrants. You can go to the next page. So again, I went over a little bit of this, but that is the address where residents can click that and visit that and pre-register. We're at about 26,000 registrations so far, which is a lot of people. 15,682 of those qualify for vaccination 1B, and currently we are vaccinating phase 1A and 1B. So you can see it's a lot of people. If people do register we are notifying people via email, and those residents that may not have access to the internet or email, we have an extensive group of employees and volunteers that will reach out to these residents and sort of hold their hand and walk them through the process and make sure that they feel comfortable with vaccinating through us into that into our reservation system for an actual appointment. We provide residents different methods of getting information from us. We've tried to be as inclusive. We've tried to include many different methods in order to ensure that residents have an opportunity to get a hold of us. The best way to get information about COVID-19 through the village is our webpage. There are so many reasons why that's the case. Number one, it's got a ton of information. Number two, we're receiving a lot of phone calls and a lot of emails, and it puts an enormous strain on staff, although we have, through the village manager's office and Manager Lockerbie, we've increased staffing and we've moved people around to prioritize taking in phone calls and responding to emails, because we know that the volume certainly has gone up. Again, people can also call the COVID-19 hotline, and the number is right there, and also email us at covid19@skokie.org. So I wanted to talk a little bit about our clinic site. It is at 770 Frontage Road. It is by appointment only. We are starting to use this week, which is, we haven't been using, is the state's EM. E as in Edward, M as in Mary, track website and system for appointments. We feel like after doing some testing on it and doing the training on it, we feel like the system is an excellent system. What this system allows people to do is we share a link with the public. We share a link with those people that were pre-registered on our registration list saying, hey, it's your turn to set up an appointment. They click the web link. It's a web-based system. And or like I said, previous to this, we will help those residents without email and or internet access to register. They register, they get an appointment, they come to our clinic, we check them in. We are verifying that they're Skokie residents. If they are healthcare workers who work in Skokie, at a Skokie provider, we will confirm that they work for a healthcare provider. And what we have found is that people are in and out really quickly. We're running a really efficient operation. Haven't received really any complaints about the clinic, but we have received a ton of thank yous, and I just want to say I really, really appreciate anyone from the public that has sent a thank you. It means a lot to the staff. I think that not only in the Health and Human Services Department, but around Village Hall, everybody's sort of pitching in, and we're certainly all doing our part to try to make this as successful as it can for the public. One of the last things I wanted to mention is volunteer recruitment. Is we are looking for licensed medical professionals to volunteer at our COVID-19 clinic, physicians, nurses, and pharmacists. We have a method and a process for people to apply, and it's what we call the Medical Reserve Corps. You can go to the Medical Reserve Corps Skokie website, and you'll find an application there, and you complete the application and submit it to the village. We have assigned somebody, his name is Dane Smith, and that's his phone number, to ensure that we can process applications as quickly as possible. And we will be using volunteers at our clinics for vaccinators, pharmacists, vaccinator assistants. We may even be using them as front-end people at check-in, screeners, working in the observation area, or even at the exit to the facility. So we have the need. Staffing the facility takes a lot of people. And if we can get some residents who are committed and willing to spend some time at the clinic and help us out, I strongly encourage people to apply. I think with that, I'm finished with my presentation, and I'd be happy to answer any questions the trustees may have.
Trustee Gray Keeler?
I want to commend you on how smoothly the clinics are going. I've just heard wonderful things. And I do have a question from a resident. She received her vaccination this week, and she was not happy when she found out that Skokie does not set up their next appointment on the day they get their clinic. She's scared the vaccines will not be available when it's time for her to go to a second time. Can you tell me what I can do to reassure her?
Of course. So the first thing is that the vaccine allocations are only going to increase. So we expect to receive more and more vaccination. We're told within the next couple of weeks that that the vaccine supply is going to increase significantly as production increases. And what we are doing with follow-ups or with follow-up appointments is through using the EM track system, we will be notifying residents either through telephone or through email that it's their turn to come back in for a second dose. And the good news is that it's not going to be a competitive process where you got to jump on your phone right away and get in. People will be given a coupon voucher that's specific to them and only them. So it sort of reserves them a spot at the vaccination clinic. And I'll tell you what, worst case scenario, if for some reason they can't make it to that clinic, although we're strongly encouraging people do their best, we will make accommodations and assist that resident in ensuring they get their second dose. So I don't think it's going to be a problem at all for second doses.
Great, thank you.
Trustee Sutker?
I too have gotten so many compliments on how smoothly the clinic runs, and I wanted to thank you and your staff and all the volunteers. The resident that I spoke to said that she was in and out within a half hour, and that includes the 15 minutes of being watched. She also had the same question, so Trustee Greg Keeler already asked it. So I think there is a lot of anxiety about, will I get my second dose? I didn't get a specific date, so thank you for clarifying that. I did have another question about the Johnson & Johnson vaccine. Mm-hmm. Is there any information about that? Because that's supposed to be a one-shot deal versus the two-shot vaccine.
Mm-hmm. Yeah, so the state hasn't come out and provided us any guidance on it yet. I think a couple hours ago, they said they were going to go for their emergency use authorization. So I do know that, Dr. Fauci said that, they're still going to try to push it out, although it's only, they say, about 66% effective versus the 95% on the Moderna and the Pfizer. So once we get a little more direction from the state, I'll be able to provide the board and the village manager's office a little more detail on exactly how the state anticipates rolling out that vaccine.
Do you know anything about the refrigeration process for that one?
I don't, Trustee Sutker. I haven't researched that yet.
Okay. All right, thank you.
Trustee Klein?
Hello, Mike. I also want to give you my kudos. I get two questions that are asked the most of me, and I'd like you to stress them. The first is that everybody must pre-register to get on the list to get vaccinated. I just wanted to stress that. And the second most asked question is, if I miss my appointment, am I out of luck? If you miss the email.
No. What we do is anybody who we invited and they missed their registration, we'll add them back to the list for the following week. So it's kind of a rolling list, so we ensure that people don't lose their place in line.
Okay. Thank you for stressing that. Appreciate it.
Trustee Roberts, I think you had your hand up.
Mike, I just wanted to ask, is there a kind of a routine or a protocol starting for you where how much lead time does the state give you, and how does that impact your planning for the following week? Or what's the routine so far for you in terms of knowing ahead of time?
I'm sort of chuckling here because
If
What
there
is
is
the
one.
routine? Let's see, I don't know how many doses we're gonna have for next week yet. We had to schedule our appointments in EM Track today just to give us enough lead time to post them later this week. Yeah, it's not easy to plan when you don't know how much vaccine you're gonna have week to week, right? I mean, I know what we're gonna have remaining after this week, but, and I know that we're guaranteed our second doses, Trustee Roberts, but in regards to first doses next week, I really don't know. So we basically have to plan staffing out a week in advance, volunteers a week in advance. I mean, I think that if you talk about like just planning logistics, there's a lot of moving parts to every week. You know, we have to understand how many volunteers we're gonna have, how many employees are gonna work each clinic, what's our dosage or allotment of vaccine, when we're gonna receive the vaccine, because if we don't receive it until after that first date, it changes things. So it's a dance every week, and we're kind of learning as we go along, and I think we're getting better. I think we have a pretty good process down, and plus we're working, and this isn't, in the past, a lot of times you kind of sometimes you work within your silo, right, your department, but we're working this is the whole village. I mean, this is everybody helping out and coordinating, and it's been an amazing effort to date so far, so. Those are some of the things that go into it, but no, it's not easy, and we don't know what we're getting next week in regards to vaccines, so. But, we sort of have protocol in place to make sure that we don't send out emails too early and register people and have to cancel their appointments and things like that, so,
But you're doing good work, so keep it up.
well, thank you.
Well, Mike is being very modest. A little bit of data. Last Friday, John told me that it was anticipated we would have approximately 800 doses. This morning, John told me it was 1,400 doses. And this evening, Mike informs us it'll be 1,920 doses. That's just a matter of a few days. And we're grateful to get the increased doses. But what it does mean is having to scramble and get volunteers, professional staff to do the work. And I am ever so grateful and very proud of how the village staff has stepped up and volunteered to help out. When we say we have the best staff in the country, I really do mean that. It's amazing how they do it. Trustee Bromberg.
Hi, Mike. I just also wanted to thank you and all the staff. I've gotten some wonderful feedback from residents. It said everything went very smooth and they were in and out, and again, 30 minutes. The question I had is, our goal is to have 80% of Skokie vaccinated, and you had mentioned that we have at this time about 26,000 registered, and it is true the cards just went out, so that should help. So how are we on target with getting the 80%? I mean, are the numbers of registration about on target with what you thought at this point?
Mm-hmm.
Or are we gonna have to ramp up, more, more just telling people more about it somehow to get that 80%? What's your thoughts on that?
Yeah, so I think that when we originally submitted we had to submit a COVID-19 vaccination plan to the state. We took a look at a couple different things. The first thing we did is 80% of 52,000 is more than 38,000, I know that. But what we did is we said, okay, what's 80% of 52,000? Well, we had to take the vaccine that we were gonna actually transfer directly to the hospitals out. And then we had to take the vaccine that was going directly to our long-term care facilities out. And I think the number we came up was about 38,000 doses up to. Now, keep in mind, that's probably, based upon the acceptance level, like a worst-case scenario for first doses. If we continue to receive, 800, 1,000 doses a week, it's going to take a long time. But I mean, our goal all along was to increase our internal capacity at our clinic, increase our throughput, increase our hours, increase our volunteers, increase our staffing to a point where we're sort of ahead of the ball game. I'll give you an example. Like, I think next week, we'll have the capacity for over 2,000 doses, but I don't think we're going to get it. So we're trying to stay ahead of the ball game, at least to be sure that when the doses do ramp up, we do have the infrastructure to push it out as quickly as possible. Plus, part of the state's plan down the line here is to transfer a lot of the responsibility for vaccinating to private healthcare providers in the hospitals. I mean, North Shore is already doing their clients over the age of 65. So, I think that the initial push here is for the health departments to do a majority of the heavy lifting. And then a month or 2 or 3 months from now, it's going to shift a little bit where people can then start going to their private healthcare providers once the vaccine is insufficient supply. So, but like I said, we're trying to be prepared, and hopefully when we get the larger doses, we're going to be able to push it out.
Trustee Ulrich?
Hi, thank you. My concern is to the immigrant and non-English speaking community. How are we getting out the information to get vaccinated? I understand the Latin American community is very skeptical in getting vaccine.
So I do know that we're currently using our e-news. The Skokie News. We're currently using our website. We're currently using those postcards, which should hit every address in Skokie. We do have people in the health department that are working directly with like the Syrian community and some of those parts of the community where, like we recently gave a presentation to members of the Syrian community assuring them that the vaccine was safe. And I know that we could probably do a little more with that, but I think we're certainly trying to use the different methods we have available to us to get the word out the best we can.
Trustee Gray Keeler?
Just curious if there's any way you think we'll know what percentage of our population really gets vaccinated. I know quite a few people that have gotten vaccinated through where they work. People that are out of town have gotten vaccinated out of town. People that live in Skokie that have been chasing down vaccines anywhere they can get them. Just wondering if you think there's any way to really know what percentage will be getting vaccinated in the end.
Yeah, every dose of vaccine that gets administered has to be entered in a system called iCare. It's the state immunization database. And I'm sort of assuming here, because I've never run this report out of it, but I'm assuming that we could run a report providing us how many Skokie residents had the first and second doses administered, or first or second. So that would probably be the best way to get that data.
Mike, thank you.
Thanks, everyone. And again, I want to thank everyone, including Village Manager John Lockerbie and his staff, for all the support. It's been great seeing everyone rally around this cause. So thank you.
Thank you.
Item B was approved as part of tonight's consent agenda, and that concludes my report this evening.
And now for a lengthy report from the Corporation Counsel's Office. Michael Lorch.
Thank you, Mayor, trustees. My report is short tonight because I have no report. The only thing I will add, though, based on the previous conversation of interest, is that I believe, John, correct me, that our website is multilingual, that you can click and change the language, and therefore, in regard to Trustee Erlock's very important question, anyone who goes to our website would be able to get the information they need in their language.
That's correct. The website has that feature for translation into over 100 languages. And then we've also, just a kind of continue on that theme, we have been in touch with the ELL Center, affiliated with all of the schools in Niles Township, who works with a lot of individuals who are speaking English as a second language. So we've been in touch with them. And then we've been able, all of the contact tracers that we've hired through the state grant are bilingual individuals. And so this is very much a concentration of our effort to get the vaccine distributed throughout the entire community.
The next item on the agenda is the 2021-2022 Cdbg public hearing number 3. Carrie Haverstich. Carrie?
Hello there. Can everyone hear me? We did a sound check before, so I just wanted to make sure. All right. So tonight is the third and final public hearing for determining funding awards for the Community Development Block Grant, or CDBG, program year 2021. The proposed funding amounts and project summaries were forwarded to the board for this hearing, along with a chart listing the funding requests and recommended funding amounts. Also forwarded was the annual matrix showing the historical funding allocations to all agencies and organizations that have ever received CDBG funding from the village, including the recommended funding for the coming year. Staff from the Health and Human Services Department reviewed the public service proposals and helped shape the staff recommendations regarding such activities, and community development staff communicated with the petitioners regarding rehab or capital improvement projects. Funding recommendations take into account existing conditions, immediacy of the problem, necessity of the public services, coordination of the work with the village's Health and Human Services Department, priorities with the village's 5-year consolidated plan, and conformance with the CDBG program and village regulations. And on to PowerPoint. All right. I'll go with this. Okay. All right. So as you see, this is the third public hearing out of 4 for the upcoming CDBG program year. Our vision statement is Skokie's CDBG program will provide a better quality of life for low and moderate income residents through bricks and mortar projects and service activities. We have 5 goals. Our capital improvements, that bricks and mortar type activities, which is the majority of the funding. Our goals are focused on housing, infrastructure, and building facilities. We also have the services component and planning and administration. So our estimated entitlement and budget, at this time we're still estimating $600,000. We have not yet heard from HUD what that amount the final amount may be. We're also budgeting $50,000 in unallocated funds, and then we've also received approximately $7,100 in program income for this current year that we're in. So our estimated budget is $657,135 at this time. And we plan on maximizing the 2 caps in the program. Planning and administration is 20%, public services is 15%, so the remaining 65% will be for public facilities and construction. So $120,000 for planning and administration, over $91,000 for public services, and then over $446,000 for public facilities and construction. And just a note that every CDBG dollar has a date stamp, and we have to use that within 3 years of the time that it's awarded to the village. So the program administration portion, it'll support the day-to-day activities of implementing our plans, preparing reports, and then also administration support such as software studies as needed. Planning, we have not yet finished or closed out the regional assessment of fair housing. So just in case we have some expenses after May 1st, I wanted to put in a line item for that. Anything that we don't spend on that, or if we wind up closing out the project before May 1st of this year, we'll put that back into the planning and administration part of the program. Public services is 15% of the entitlement amount plus that $7,100 plus program income that we've received. We did need to reduce the requests and want to go over the tiers that we established 6 years ago. Tier 1, the village human services staff depend on that specific organization on a daily basis. Tier 2 organizations, we depend on them as needed. They are a critical service, so we want to make sure that they're available should we need them. And then Tier 3 organizations, the services are important but not considered as critical as Tier 1 and 2. And then Tier 4, other resources are available or Cdbg funds are prioritized elsewhere. So our Tier 1 recommendations for the social worker position, we're recommending $41,070 for our social worker. And the balance of the full-time salary for the social worker would come from the general fund. Jewish Child and Family Services, we recommend $4,000 for a financial case manager who will assist with accessing resources to regain and maintain financial stability. Asian Human Services for their dental services component, we're recommending $7,000 to support their dental services. Metropolitan Family Services, we recommend $6,000 for counseling, grief, trauma, and other family services that are needed by Skokie residents. Peer Services, $6,000 for a part-time treatment, engagement, and retention specialist for substance abuse. North Shore Senior Center, we recommend $8,000 for long-term case management and counseling services to enable elderly to remain in their homes as long as possible. And Youth and Opportunity United, we recommend $5,000 to offset the cost associated with the youth development specialists for Lincoln Junior High, Old Orchard Junior High, and Edison Elementary. In our Tier 2 organizations, again, we depend on this critical service as needed. Children's Advocacy Center, we recommend $4,000 for an advocate and counselor to support child victims of abuse and their non-offending family members. The Harbor, we recommend $4,000 for emergency shelter and transitional housing for youth. Our Tier 3, we do have two organizations that we're recommending Tier 3 and actually recommending funding. Sometimes our Tier 3, we have them as an alternate, but we feel that their focus is something that's in our 5-year plan, and so we're recommending providing funding for these specific organizations. So Center for Enriched Living, they plan on supporting employment services for Skokie residents with developmental disabilities, as there's an 85% unemployment rate, and if employment services or just employment in general has definitely been more on the forefront of my mind since COVID started, so this is definitely something we would like to support. And then also Impact Behavioral Health Partners, they're also looking to support employment services, $3,000 for that, for serving Skokie residents with mental illness. And we do not have any Tier 4 organizations, so we are not recommending to not fund any organization this year, which is a nice thing to be able to try and support everyone. And on to our capital improvements and rehabilitation, again, $446,000 plus. And this is the 11th year of the 25% match by the organization receiving funding. So our home improvement program, we're recommending $80,065 for single-family home repair. It's been in place since 1983. Grant payments are $12,000 maximum, and there is a graduated payback agreement over 15 years should they sell their house within 15 years of the improvements. The Housing Opportunity Development Corporation, we're recommending $19,500 for 2 out of their 4 requests. They prioritized structural improvements and furnaces and hot water heaters for their locations listed here. I believe at least 3 will be helped with these 2. There was the different locations had different needs, so we're supporting at least 3, if not 4, of the addresses listed here. So it would be 14, at least 14 units supported with this funding. The Neighborhood Enhancement Program, we're recommending $70,000 to further affordable housing at a neighborhood level, much like our home improvement program, but looking at a concentration of households within the neighborhood. Street resurfacing, we're recommending $198,000 to resurface Lamont and La Crosse Avenues, north of Greenwood Street and south of Grosse Pointe and Church Street. The 50/50 sidewalk replacement program, we're recommending $3,000. And the focus area for this coming year is any part of the village south of Howard Street. We can include supporting households outside this area upon request. Turning Point, we're recommending $20,000 for a rooftop HVAC replacement, their next most problematic unit. Shore, we're recommending $8,000 for ejector pump replacements. We want to keep the basement dry. There's an upcoming project and past projects where we want to protect the HVAC investments that we've made already. So this is a higher priority for them. Should there be an emergency and they have to replace it ahead of time, then we would support the VAV box replacements. They've been working on replacing those incrementally over the past few years. CJE Senior Life, the Village Center, right behind Village Hall. We recommend $15,000 for the boiler control system. They recently installed the boilers, but this control system would help with the expanding the boiler's lifespan, performance, and energy efficiencies. And also the maintenance staff would be able to control remotely the system, and then also it would also help with a greater consistency of indoor air temperature. And search, we're recommending $18,000 to replace the concrete driveway as it's in need of replacement to ensure to avoid tripping hazards, and then also creating a larger concrete landing for the AD ramp that's part of this current year's project to ensure egress from the building, and then also to be able to use the backyard as well. In Orchard Village, we're recommending $10,000 to upgrade the kitchen for safety improvement purposes. Orchard Village will have a bigger share of this project due to past Cdbg investments that have occurred within less than 15 years ago. And then Asian Human Services, for their construction-related project, we recommend $4,500 for their UVC sanitation air purifiers. I have been working with HUD staff, and they've been working with HUD headquarters on this. I am hoping that we might be able to use Cdbg funding for it. There have been a lot of questions back and forth, so hopefully by the action plan meeting on March 1st, we'd be able to confirm whether or not we might be able to use Cdbg CV funding. In theory, it should work, but I want to make sure HUD gives it the blessing first. That would enable them to install the units sooner and prevent the spread of COVID, again, sooner than, say, waiting this fall. And if that is the case, we would recommend another $2,500 to Turning Point and another $2,000 to Search, as we kind of deeply discounted their recommendation. And also, we're able to plan for this now, even though we don't know how much funding we're receiving. So we can do that with building a lot of flexibility into our draft plan. And so it's plus or minus 20% of the $600,000. So we will need to do a substantial amendment to the action plan if entitlement funding is less than $480,000. If we receive more than $720, we will not pursue a substantial amendment. However, we'll use those funds in the following program year. And then if it is less than $600,000 from HUD, we'll do our best to do across-the-board adjustments. We will not reduce anyone's entitlement less than 80% of the budget amounts, and our goal would be to not have any amount less than $3,000. And there may or may not be funds available for construction rehab projects. I think we're at the point now, we try and keep a little reserve, but we might need to have projects come in under budget to have additional funds available. But we may be able to use that to maybe plug in some additional funding for construction-related projects, should it be less than $600,000. And if our entitlement funding is greater than $600,000, we plan on maximizing that 15% cap for the social worker position up to the amount requested. And then the home improvement program will fill that amount to the request, the 90,000 request. And then any additional beyond that will apply to the neighborhood enhancement program. And so the application or the action plan submittal deadline is typically St. Patrick's Day, but since we don't know the funding at this point, it'll probably be later. But the latest we are to submit is August 17th of this year. Are there any questions?
Let me get a motion first, and then we'll take questions. Trustee Klein, seconded by Trustee Bromberg. Now, comments or questions? Trustee Klein?
Yes, I just have to say, I want to thank Carrie and her team for doing all the research and a job very well done. I mean, in the years I've been doing this, I've never thanked you. And I just wanted to do it now. So thank you for everything. I know I have a small idea of how hard this was. So I do appreciate it.
It was a little easier this year because we didn't have to not recommend funding somebody, so. As long as you support the request, the recommendation, it'll be a better year.
Thanks again.
Thanks.
Trustee Roberts, I think your hand was up.
Yeah, thank you, Mayor. I'm just, I know that the organizations aren't here tonight, but it's just as this is my last time to participate in these community block grant hearings. I'm just reflecting on the breadth and depth of the organizations and the nonprofits we have in this village, and just to express my really deep felt appreciation and thanks to them. You know, they really represent the best in our community, and they are truly our safety net. And I hope they all are, at the end of the day, have a great satisfaction in what they do, because they're helping people that need help the most. And there's no greater good than to do that. They're helping the most vulnerable people in our village. So I deeply appreciate that these organizations, including our own very own Edie Sue Secker, you're doing noble work. You really do. And I really thank you. Thank you very much.
Well said. Well said. Call the roll, please.
Trustee Roberts,
Aye.
Trustee Sutker,
Abstain. I recused myself at the previous CDBG hearing.
Trustee Ulrich,
Aye.
Trustee Bromberg,
Aye.
Trustee Klein,
Aye.
Trustee Gray Keeler,
Aye.
Mayor Van Dusen.
Aye, the motion passes. And Carrie, thank you.
And thank you.
It is you make it look easy, but it's a very, very difficult job. And we appreciate the effort. As Trustee Roberts commented, these groups do the real heavy lifting in our community, and the help that we're able to give them through the CDB program over the years is very instrumental in getting that work done for the most vulnerable in our community. So, Carrie, thank you.
Yes, thank you. I'd also like to thank the organizations with our outreach, and then also village staff to help put this budget recommendation together.
And John, citizen comments?
We do have citizen comments for this evening. The first one is from Barry Timken. He's a 32-year Skokie resident. Please rethink the downtown hotel project. You are turning downtown into a canyon. The 12-story project is pretty, but monstrously large. You are also cutting off green space. Lorraine Targos, Mayor Van Duzen and Skokie Board of Trustees. I am a K-12 alumni of District 69 and District 219. I now work as a scientist in the city of Chicago. I'm writing to demand the village leadership finish their 2016 to 2021 sustainability plan with a special focus on energy conservation and air quality. For the sake of equity, please hire a minority-owned or woman-owned firm to conduct a greenhouse gas emissions inventory this year and take action to regard climate change as the existential threat that it is. Dr. Bala Chaudhry. I am writing today to urge the village trustees to create a new full-time staff position of Chief Sustainability Officer to oversee the creation and implementation of environmental sustainability measures for the village. I'm an environmental scientist and professor at DePaul University and have been a resident of Skokie since 2011. I conduct research on climate change solutions and train our future specialized environmental workforce. It is my job to stay abreast of the most up-to-date environmental sustainability initiatives that municipalities undertake. I have been disappointed to see a lack of serious commitment to environmental sustainability by Skokie leadership. I appreciate the work that the Sustainable Environmental Advisory Commission does, but there's only so much an entirely volunteer and largely untrained group can do. A chief sustainability officer could oversee the completion of a village-wide greenhouse gas emissions audit, as well as the creation of a comprehensive climate action plan. Chief sustainability officers are highly trained technical professionals with experience in energy efficiency, environmental justice, water and waste reduction, renewable energy, and climate action and resilience. In fact, most Fortune 500 companies employ a C-level executive in charge of overseeing sustainability practices. Several of our neighboring townships have full-time staff devoted to environmental sustainability. I know this because I interact with them professionally, and they have told me how Skokie Village staff routinely solicit their advice on environmental matters. How embarrassing that Skokie values environmental expertise but is unwilling to pay for it. Not too long ago, Skokie was named a preferred Chicago suburb for millennial homebuyers. It is also important to note how strongly millennials feel about investing in policy that plans for the inevitability of climate change consequences. It would be a shame if millennials choose instead to buy homes in townships than invest more in environmental action. Mayor Van Duzen and Skokie Board of Trustees, I'm writing to ask the village to commit to finishing its 2016 to 21 environmental sustainability plan. I feel proud of our community for the work that's been done thus far and for identifying sustainability as a priority to begin with. I also understand how the pandemic and its effects have caused some of that work to be placed on the back burner. However, I would urge you to be forward-thinking on this issue, since the climate crisis is a matter of grave urgency that will have deep and incredibly difficult impacts on all of our lives in the years to come. We will see those impacts in all aspects of life, from food security to health to housing to safety. It's really impossible to exaggerate the unprecedented gravity of what we face. What you do now can and will make a real difference for our community and our children. So again, I urge you to finish the sustainability plan and recommit to sustainability both now and in the future. Respectfully, Maggie Vandermeer. Here are my comments for tonight's board meeting. Thanks, Molly Greening, Skokie. I believe she's written this as a poem. Climate action matters. As the mute buttons get stuck and we stay 6 feet apart, from our lonely departed. As the zeros in offshore bank accounts balloon, while suicides skyrocket, income dried up. Think about one moment about climate collapse. Why could we not see this is only the beginning and it's already too late? No more studies, reports, plans. What must be done is something no one wants to do first, except for those of us obliterated in the outcomes. If only we could reach across that wavering line, the one that separates us from the mind, from body from earth. It's just back to the basics, the irresistible balance. Your ancestors didn't forget, even if you did. The next 3 communications are very detailed and have already been shared with the village board this evening, and they will be addressed at the next village board meeting on Tuesday, February the 16th. They pertain to sustainability, and they're from Go Green Skokie, it seems like a group, James Johnson, 4821 Hall Street, and Catherine White, 5201 Golf Road. And that completes the citizen comments this evening.
Thank you. One of the things that I do want to assure everybody is that when the village of Skokie makes a commitment, we take it very seriously. Every 5 years, we do a sustainability report which outlines our goals. It is comprehensive in nature, and it has always been forward-thinking. I would also point out that the village of Skokie in 1988 was the leader in creating the Solid Waste Agency of Northern Cook County. And the recycling that you see in the region is a result of that commitment. We have every intention of completing the program, and we will have it done by the end of the year. Everybody needs to bear in mind that it's comprehensive in nature, involving our health department, our sustainability commission, as well as our public works department. Right now, our central goal is to get people in the village of Skokie vaccinated. That is the preoccupation, as everybody saw earlier this evening, of our health department. It also includes our sustainability. It also includes our public works department, as well as our police and fire departments. We thank all of them for everything that they do. We will get the sustainability report done. The village of Skokie residents have our commitment, and they have our word on that. And with that, next meeting, we will have a report on the progress.
That is correct, on the sustainability plan and our plan for the next plan.
Thank you. Trustee Roberts, I think it's you this evening.
Thank you, Mayor. I'll make a motion to adjourn.
Thank you. We are adjourned.